Hi, my name is Becky Dawson. I am the director for the Northeast Missouri AHEC office here in Kirksville. We serve 21 counties, but the reason I'm here is that today's presentation is all about a national project that the AHEC office has with the CDC out of Atlanta, and we want to share with you some information about the HPV vaccine. It's a 5-year project, but we are delighted that the physicians can share with you some of the updates in terms of the information about HPV. The whole idea is that across the country, we want to help lower the rates, increase the rates of immunizations and lower the rates of and prevention of cancer. So I'd like to introduce Dr. Campbell, and you'll take it from there. Thank you.
Hi, my name is Campbell. I'm your moderator today. I'm here to introduce our two speakers, Dr. Shakila Mathew and Dr. Melodie. They're both board certified physicians who are graduates of Kirksville, like myself. But the reason I chose, when I was approached about doing this, I said yes, because I'm a huge advocate of the HPV vaccine. I spent a lot of time talking to patients all the time about how they could lower risk for certain kinds of cancers. But when we talk about preventing cancer, you know, I always thought, well, if you cut down smoking rates, you certainly lower the risk of smoking, but it doesn't prevent necessarily people from getting lung cancer, right? However, I think there are 2 times, I always said this to patients, I think there are 2 times when you can truly prevent cancer. That's with screening colonoscopies, because while not every polyp becomes malignant, certainly every malignancy starts out as a polyp. So every time you remove a polyp, you potentially prevented cancer. I've told countless patients that, and I feel the same way about the HPV vaccine. You can't get cervical cancer if you don't get HPV. And so I was a huge advocate of both of those for many, many years. I will share with you something I just printed off. This was in pediatrics earlier this week. They reported that girls between 14 and 19 years old saw infection rates on the 4 types of HPV covered by Gardasil vaccine fall 64%. Since the introduction of the vaccine. The other is that women ages 20 to 24, the prevalence of infection declined 34% in those same years, those several years that it's been available. Fortunately, it's not a huge percent of the population, but it is a significant number. The objectives today, what I hope you walk out of here understand or furthering your knowledge of, is that the importance of HPV vaccine, not only for cancer prevention, again, that word prevention, and the rationale for vaccinating individuals at a young age before they're sexually active, why we not only vaccinate females, but also males, the vector, provide useful information about how you would, I don't want to say talk parents into it, but how you compel parents to think about vaccinating their young children, especially at ages when they think vaccinating, I'm sure you'll talk about this, what approaching someone about doing a vaccine for this, what the undertones are, and then how you can locate resources. So if there's no questions, I'll just move straight into the presentation. Dr. Melodie Stocks, who is a board certified OBGYN here in town, a Kirksville graduate.
For a little longer.
For what?
I'll have to do my recertification in 2 months, so I guess if I don't pass, then I'm not board certified. So I guess it's hard to make this super interesting, but I'll try. So HPV, we talk about this every day. I had, like, in my last 2 patients were discussions on HPV before I came here. One with patient said, I told her I was coming to do this talk. I'm like, so if you were 16 years old and somebody told you you had the HPV vaccine, would you get it? She's like, yes, because she's now had persistent abnormal pap smears that are just bad enough to come get a pap smear every year, but not bad enough to do anything about. And she also had genital warts. So she definitely, she's like, if this was an option for me, I would have told everybody to do it. And really, I would think you would get that story from every single woman that's affected, and it's a lot of women. It's definitely prevention for cancer, and that's the push, because that's what kills you. But there's a huge morbidity associated with HPV, and it really prevents a lot of other issues. As far as the infection, most males and females will be infected at some point in their life. One of my favorite studies was a college study, and they had women self-collect HPV tests, and they did it online also. So they were college students coming into college who had no prior sexual activity, And then they actually documented on the computer, so somewhat anonymously, and they collected their samples themselves, which we do actually know self-collecting is a very good thing and very useful to self-collect tampons, to do PAPs, and it's very accurate. So they self-collected, they said if they used a condom or not, and they found that there was 80% of women in the first year of college initiating intercourse, if they ever did not use a condom one time, got HPV. It was amazing. So probably not the exact statistics, but it was like incredible. Like, and the people who used condoms every time didn't get HPV, but it was just like everyone before not getting it, they got it. It's just that prevalent. So I do tell patients, you know what, you're probably going to get it. If you ever have sex with somebody who's ever had sex with one other person, you're probably going to have it. Now, that being said, most people never know they have infections, and most of the time the infections are cleared, and that's why we are very strongly say do not screen people for HPV under the age of 21, because we don't want to know. Because then we go down this long road and they freak out and cause other things. So super common in teens and early 20s. Like I said, that's why we don't even test for it anymore, because we don't really want to know. You consult me for a positive HPV in an 18-year-old, then I'm not going to like you. Because to be honest, we don't have guidelines on management. So I'm like, well, crap. So I don't know what to tell you. Let's go give you that HPV vaccine because you still need it. New cancers. For women, cervical cancer is the most common HPV-related cancer. For men, it's oropharynx. Anal cancer is also a big deal. We don't have any screening guidelines for anal cancer yet with HPV, but we do know that it's a big deal. Vulva, vagina, oropharynx cancer isn't that common or as common in women, but I did have a patient with HPV-related oropharynx. She had tongue cancer at age 28, had only smoked for 3 years. And got a recurrence in her next pregnancy. It really sucked. I have her tongue removed. Without vaccination, annual burden of genital-related HPV is a lot more. It's a lot. It's expensive. We see people a lot for this. It's common sense. The biggest push right now is to tell patients that HPV is cancer prevention. When you say that word, you can prevent cancer in your kid. It's a lot more likely to go over with parents than saying you're going to prevent an STD. Because they don't want to think about their kids having sex. Girls and boys can start HPV vaccination at age 9, although I think it's more common to start 11-ish with the shots. My son is getting his in about 6 weeks at his well-child visit. He's going to hate it, but that's okay. Preteens should finish the HPV vaccine by the 13th birthday. So why? This is easy. Big fix. Yeah, because they're going to start having sex. You want to get the virus, the vaccine in before they get the virus. The girls age 13 to 26, if they haven't started, we want them to start. I start people all the time in their early 20s on the HPV vaccine because they didn't get it before that. Sometimes because their parents didn't want to have them, and now they can make their own decisions about their health care, then we talk about it again. So there are really weird rules around that. So if you're Medicaid under the age of 19, we can't actually give the vaccine in our office because they still fall under the Vaccines for Children program. So they have to go to a pediatrician or a health department or family practice. So it's bizarre. And then some companies won't actually pay for HPV vaccines in women over 18 years of age, but Merck does have a program that it's a free, essentially, if their insurance company won't pay for it. So there's not really a reason that you can't get somebody, although I find it very frustrating, especially my young mom, 17, 18 years old, that I cannot get the HPV vaccine. Boys, I think it's honestly unjust, but they cap it at 21 for guys. And I can't remember why. I'm sure it's some statistical significance somewhere. I don't think it's fair, but as far as the vaccine, again, it just makes sense. There's a bivalent vaccine that I've never seen used ever, and I don't even know if it's on the market anymore because why would you vaccinate with something that's not going to cover as much? The quadrivalent we've used for a long time, and then recently, which was made by Merck, and then Merck came out with a 9-valent vaccine, which is more effective. They are quoting 90% coverage for genital warts, which is the same because we still have the 6 and 11, and then they've added all these high-risk HPV type 16 through 58, which now they say covers about 90% of cervical cancer. In the US, I should say, because there's like a bazillion types, 30-something types of HPV that affects humans, and it is somewhat regional. This is pretty much just going over I guess if you're immunocompromised or men who have sex with men, you can get vaccination through age 26. I used to cry about it. And for the males, it's only Merck's vaccine is FDA approved. So big questions that we get, which is essentially what the next set of slides are. If the vaccine, let's say you don't know what type the patient got and they got quadrivalent at their last doctor's office, and now we only carry 9-valent because why would we bother carrying quadrivalent, which is the truth, then what are you going to give? And you can finish it off with the 9-valent. They say any type, and made a big stress here on the slide, any vaccine product for women, and only 4 or 9, but like I said, I've never even seen the bivalent, so I don't really think it's relevant. So basically, you can finish their series with whatever vaccine that you have available. And then you want to start on schedule. In our office, we typically do a 2-month interval. I don't know why, that's just how it was set up, but so essentially it'll follow like your hepatitis B, same type schedule. And then the next really biggest question I get is if it's interrupted by like 5 years, which is what happens all the time. I got it when I was 16 and now I'm 21, can I finish it? Yes. If they're not even sure, we just start over. A lot of them do know, or they'll ask their parents, and the third one seems to be the most missed vaccine. Like they'll get those first 2 and then they miss it, and so we will vaccinate the third one. As far as safety, you want to balance your efficacy with your vaccine-associated risks. There are seriously like really cool websites out there about Gardasil syndromes and all kinds of stuff. If you ever wanted to laugh, these people are dead serious though about all the things that happen to them because of their vaccine, and it's really sad. So there are some parents that will refuse vaccine based on mass media against the vaccine. However, the most serious side effects cited headache, nausea, vomiting, fever, and syncope. I think they report like, I don't know, fairly high rate of syncope, although we are bad in our office and we do not adhere to 15-minute observation. Because we've never had anybody pass out. Or if they do, it's just like make it your blood drawn. You can look at them and see they're woozy, up and down, watch them. I know the health department, they're really strict about that. Vaccines, probably NPs too, because they're more careful than we are. But we take care of adults for the most part. So and honestly, by the time they check out, the checkout window, get out the doors in 15 minutes. So we do our vaccines. The vaccine safety-wise, there's thousands of these vaccines that are given out worldwide. So I would think at this point in time, we would see some huge problem. And I've been out 7 years. We started vaccinating while I was in residency. So it's been 10 years of just data, and there was 10 years prior to that of data before. So a lot. And they are saying more injection site reactions. We have never had a patient ever call back about their HPV vaccine and say they have a side effect of it, which is pretty good considering we get them on Tdaps and other things like that. We'll hear back from them. And then they look at impacts and studies. So where your early outcomes, your mid outcomes, and your late outcomes. Cancer obviously is a late outcome, and we're starting to see some data on that. Most data is going to be in this early outcome, which is kind of like what you were quoting, some early outcome data. And so they're evaluating it in some of the countries that are very, maybe better at vaccine than we are, and studying those. So at this point in time, and people ask the same thing, how long is the vaccine going to last? We don't really know. At this point in time, there's no boosters, but there's not any evidence to show waning of immunity at this point. And they're studying it, so we'll know eventually. We are pathetic in getting all 3 doses in. It's not quite so bad if you actually look at the data. So 60% at this point in time, which is fairly recent data, we got 1 shot into the girls. For boys, they're here at 40%, they're getting 3 shots, and boys now 20% actually get all 3 of their vaccines. Girls are a little better, but we're still getting 40%. And our goal is to be up here. Tdap is this number, almost 90% of people. So somebody did a study and said, hey, we could be better. Shakila's turned on how we're going to be better.
Okay, so what we're going to kind of talk about is how to frame a conversation. So pretty much how to talk to parents about HPV vaccine. So if you look at this graph, you see the dark blue is parents' impression on how they think about HPV vaccine. If you look over here, HPV, it says 9.3, and pretty much they compare it equally to an influenza vaccine. So for instance, I had a kid today, the parent declined the flu vaccine right before to the nurse. And then when I went in there, like, would you recommend the flu? I said, yeah, I would. Okay, we'll get it then. So it's as simple as that. So physicians, what they do is they underestimate the value the parent places on the vaccine, on the HPV specifically, but it's actually as similar to any other vaccine. So if you look over here, Dr. Stocks mentioned it already, that HPV vaccine is given at 11 to 12 years of age. And a recommendation from a physician is pretty much the key. So if you recommend the vaccine, they're going to get it. But if you don't talk about it, they may not get it. They may not think it's necessary and it's not a required vaccine, so they just move on to whatever is recommended. How do you do an effective conversation? The same way you would recommend any other vaccine. So for instance, you have a kid that comes in for a 2-month Welch shot. You're just going to say your kid's going to get Tdap, hit, polio, Prevnar, rotavirus, hepatitis B. Sounds like a lot of vaccines, right? But it ends up being 3 shots and 1 oral. I say this to parents all the time. They don't question it. They say, okay, we'll get the 2-month shots and move on. Same way when they come for their 11, 12-year-old child, you're just going to say your kid's going to get Tdap, meningitis, and HPV vaccine, and it's going to prevent against all of this, including cancer. So it's not that you're lying to the parent, you're just saying, these are the 3 shots we recommend. And then you give information, and most parents end up saying, well, if you recommend it, we'll get it, you know? However, as you know, if you've seen in clinic, you're going to have one of those parents or several of those parents who are like, why do I have to get my kid vaccinated and it's HPV? She's only 11 or he's only 12 and not sexually active. So that's going to be the question, right? So we just discuss how to introduce it. Just Sophia, the 3 vaccine protects against meningitis, HPV, pertussis. We'll give these at the end of the show, end of the visit. So simple statement. Now, main concern, why do you need this vaccine? As Dr. Campbell was saying, it prevents cancer. So if you say that to a parent, they'll think about it. Oh, wow, it's going to prevent against cancer, so I probably need to get my child vaccinated, right? Parents are going to be like, let's wait until at least her marriage, you know, she's not sexually active. I know she's not going to be sexually active now. But the problem is when they get married, they're going to be exposed to somebody who's already exposed to HPV, and they can get it from them. Now, most of you are going to think, but why 11 and 12 years? That's too early, right? Can we wait like 15 or 16, right? So for that, the answer is going to be HPV vaccine produces a good immune response in preterms than in older teens. So that's what Dr. Campbell was mentioning. Older teens, they've noticed a lot of kids with HPV positive. So if we catch them before they're exposed, then you're going to prevent against cancer. So we all have family members. We have children, we have grandchildren, or we have nephews and nieces. So when you go to a clinic, if parents are still against, or just kind of not for the HPV, you should just say, I would let my family member get vaccinated against HPV. If you say that, they're going to be like, okay, if you would give it to your child or your family member, that's something that I would consider. And so far, we've had success with it, unless the parents are like against it. When they come, they're like totally against it, then it's going to be, you're going to have always that 1 or 2 patients who are not going to get it. Okay, so side effects, Dr. Stocks talked about it. It's just a little bit redness and a little bit of pain in the arm. They can have dizziness. We do make our kids wait in clinic for a few minutes just before they leave, 10 to 15 minutes. I think last time the health department, they said that 10 minutes. Not clinic, but it really doesn't matter. And we've not had any problems with the HPV. And before they leave the appointment, always remember, tell them this is a first shot. You don't want them to miss the second and the third shot. So make sure when they leave, they make a follow-up nurse visit. So that way they get reminded, and we always send a text reminder about the visits and stuff so they can come back and get that follow-up HPV vaccine. Okay, so take-home point is HPV vaccine is cancer prevention. And you as a physician can make a big difference. As I said, like if you as a physician just say your child needs HPV vaccine, they will consider it and might as well get it, you know. But if you don't mention it, they're not going to get it. So, okay? That's it.
each of you should have received a vaccine schedule. And then I think there's a questionnaire on the back of it. Is that right?
Right. The handout that has some information from CDC, and the last page is just some evaluation questions, so we can have feedback from you and incorporate that in the presentation.
Does anybody have any questions or comments on what we covered today?
I think they just published a study that they showed decreased rates of HPV infection since the vaccine.
Significant declines in both teens and 20 to 24-year-olds. It was in pediatrics earlier this month.
The most interesting adverse effect I've heard for the HPV shot is it said that throughout some girls' menstrual cycle pretty bad. She had very bad periods after getting the shot. Have you, any of you seen, heard of that?
I have not, I should say, I have not experienced that. I have not heard of that before.
I
Never
remember
that.
that it's the younger kids we give it, so,
Yeah.
you know.
Well, and
maybe
then
not.
that's like the risk time to have worsening menstrual cycles
Yeah.
anyway.
Right.
I don't know. I mean, I can't like physiologically wrap my mind around how that has anything to do with
I would have to say, is there cause effect, and then also what's the N number? How many is, if it's one or two
That's
people, it's not a
not
trend.
one so far,
Was it an older person or a younger?
like a later teen.
And it could be that they were right in that 2-year period where the
Yeah.
periods were regular, you think?
It's hard to know. I mean, you can't argue with them because they're gonna believe it. So then you
Yeah.
say, I'm sorry, but now you're not gonna get cancer. Do you like some ibuprofen?
We used to from the very beginning, when it was first released, and we had girls getting lightheaded. I don't remember anybody actually fainting, having a single one. So we did have girls complain of lightheadedness. We laid them down for a few minutes and they were fine.
And that's what they say. I mean, I'm sure it happens. Just I probably am not aware
I've never
of it.
witnessed a syncope, so.
It's kind of like the MMR and autism, like, you know,
Right.
they just kind of have it right on.
So I had a patient who, parent expressed concern that he was given, their kid like the green light to be promiscuous.
Uh-huh.
So what do you say to those people?
We're preventing cancer.
Well, I think, yeah.
Yeah.
Let me honestly,
But I mean,
like,
That's gonna do it anyway.
So, yeah, but like, so the mom was really concerned about this.
Yeah.
Cause she's using, I guess she was using, I don't know, I didn't get into it, but like, maybe she was using sex as like a fear, you know, like you have sex. you
Well, I
get
think
cancer.
Was the patient in the room?
Like,
Was the
huh?
patient in the room?
Yeah, yeah.
You know, we.
You talk about syphilis.
Yeah, cervical cancer is not the worst thing you can get from having sex.
Yeah.
It's not even.
Sometimes
The baby, yeah.
sometimes your genes get a little tight and you're a teenage mother.
Yeah.
I would always tell them, look, you know, the vast majority of your daughters are gonna become sexually active at one point or another. The sooner you vaccinate them, the better response they have. It doesn't make any sense to let, you know, when they would say why, I would say, why not?
And if
Give me
I-
one good reason why you wouldn't, and they rarely came up with it.
Yeah.
we get the same thing, like, sometimes even some women, like maybe let's say 22 come in for their first exam and they've never been sexually active, they're like, but I'm not even sexually active. And I will even say that even married women in monogamous relationships, like you have to frame it differently. Like I'm married, I've already been exposed. I'm like, but you don't know 10 years from now what your life is going to be like. And there's a time limited thing. You hit 26, nobody's paying for it anymore. So I use that a lot. I'm like, you know, it's not going to hurt you. It potentially could have benefits 20 years from now when you have another partner, because there's a, you know, 30% divorce rate or higher. I mean, you hate to tell people that, but I just say, you know, you just don't know what the future holds. And I say the same thing to the parent, you know, you don't know what the future holds. Your kid's probably going to be sexually active by the time they're 50. And I have 70-something-year-olds come in because of HPV still. I mean, it's not like it's.
Our own daughter didn't want to get it, only because she has a needle thing. We don't get a needle or talk about needles, but
Just give her a shot. We sedate her first.
yeah. Well, we eventually just said, you know, Jesse, you need to do this, and she was fine. I can't think of a good reason why you wouldn't give it to somebody. Unless they plan on never, ever being sexually active in their whole life.
And somehow they don't give any sort of sexual assault.
Yeah, I mean, sexual assault or something, they may not plan to be sexually active, but
Yeah.
I actually was married
Somebody
and was just
Hold
had
on.
one partner all their lives, but their husband, you know, had just one additional partner.
Yeah.
The husband gave them away. have had one partner.
Yeah, that's what Dr. Stotts was talking about. 80% of college females who had intercourse, unprotected intercourse one time developed HPV. It's out there. Your chances are too great. I just never had one single parent come up with a reason why they wouldn't give this to their child. Other than that, so you're promoting sex and teens. Not at all.
I've heard
They're
it
gonna have
too.
it,
Like,
I'd
I've definitely heard that argument, for sure.
I'd rather have them protected.
They say the same thing if I tell them about condoms and birth control. Like,
And you can tell them giving it earlier has a better immune system for the kids, and it just means that the vaccine works better. So it's better to get it now rather than wait for it. It doesn't mean that they're saying it's okay. It's just-
Most of them don't pull out of the driveway without their kids having their seatbelt on. This is the same concept.
Is it mostly,
Same concept.
it's mostly the girls? Parents are, you ever had a parent not want to give it to a boy?
Actually, back then we didn't have a
don't ask
lot.
me that question.
Back then we didn't have a lot of parents who wanted shots for boys, the HPV. But now it's a lot more. People are a lot more open. We don't have a lot of. We don't want the shot. They're all coming for it.
Yeah, and if you can tell them that, look, your son could get this, and then he would be the vector. He is responsible for other people getting a lot of people. They will say, yeah, I guess I really don't want to be responsible for that.
Or just say the words penile cancer risk and then they'll get it.
I never ever said that once, John. I don't think I ever said that once. In my whole life, I've never said that. Okay, we're in the conversation's wrapping.
Kind of along that line, if you take a 12-year-old girl into a room and you say the word cancer 8 times and then give her a shot, you're probably going to see an increased rate of syncope. So maybe a strategy you can use to prevent that is if they're on board, just let it go. And be like, all right, good, you're good for that. We don't need to talk about all of the cancers.
I think the resistance significantly decreased from the time it was first released or introduced to just even a couple. I mean, just in the first 2 or 3 years, I saw the resistance resistance to having the vaccine rapidly. Is that fair?
We got way more refusals than acceptances at the beginning.
Yeah.
And now it's the opposite. I rarely have anybody refuse. I would say in my older, like that 20 to 26, I have more refusals, especially in the married women. I just can't convince them that they need it. But.
Okay. Any other questions or comments? If not, thank you so much for attending. I hope this was useful. Please take some of the materials with you and promote this vaccine for the good of all. Thank you.